Good day, everyone. My name is Grace Osuji. I'm a family nurse practitioner and also a student in Brahma University. I currently work at Advanced Med Health. I'm here to present the stakeholder education plan. There are various stakeholders in the health industry that facilitate the provision of quality health care to the patient. It is important to ensure that the stakeholder in a health institution are educated to ensure that they have necessary knowledge and skills to administer to the patient. This will equip them with the ability to implement research into practice. Evidence-based practice is important as it translates researches into innovation practice. This paper will look into the application of a single subject design of substance abuse individual. A single subject design is mainly focused on one individual, and the study we are undertaking are used to come up with a solution that uniquely match the individual. So the main stakeholder involved in this single subject designs are the social worker, the therapist, the psychiatrist, the nurse, and the doctors. For a single subject to be effective, there are need for sufficient planning prior to the research and active involvement of a patient as the research is conducted. So the doctor and the nurse are the individual that deal with the patient addressing their medical concern. So the therapists handle the psychological and emotional status of the patient, ensuring that they are able to handle their condition. So the social worker is a task with a role of implementing the research, working closely with the patient to create an intervention plan. So they ensure that the patient takes their medication on time and attends self-help group where necessary to tracking their accomplishment over a period of time. When applying a single subject study design, there are several approaches that can be applied. For the task-centered approach, a research looks closely at the day-to-day activity of individual and the behavior changed by the research participant. So the solution-focused approach study to individual reaction to a various proposed solution. So both these two approaches play an important role in carrying out a single subject design as they give the researchers an opportunity to understand the individual better. To find out whether an individual is improving, the various results compared to the current outcome are a bit of improvement recorded by Cook 2008. So physicians are the medical doctors who have completed their graduate training and are certified to provide healthcare service. So the nurse practitioner are advanced practice registered nurse who requirements include having a Master of Science in Nursing or a Doctor of Nursing practice. Allied health professionals are the therapists and technicians that need to have an educational qualification that license them to become a therapist. Healthcare administration and social worker acquire a bachelor degree in health administration and business administration and also outstanding communication skills. Unlike physician, nurse practitioner, and allied health, who require a degree in master's and acquire experience in medical in order to operate. Further, they need to possess approved practicing certificate. Prior to the research, a plan will be drawn for the patient. So the plan contains the intended set of activity to be done by the patient by Johan Malik and February 2015. This will be accomplished by not only considering the number of complete tasks achieved, but also regarding the nature and manner of the task. So it is a 10-point scale where 0 is the lowest performances and 10 is the highest performances. So the measure used make it easier to track the performances and the quantitative variable, enable one to easily monitor progress. Given the experiences are done regularly after a given predetermined interval. So the baseline is a result taken prior to implementing the intervention an approach as it can be used as a basis for to determine whether the intervention method is effective. It is vital to involve a patient in the research as they best understand themselves and depending on their personal condition. Then a favorable solution is to be found. The main principle of healthcare management is providing quality care to the patient. So the focus is often on the need and the satisfaction of the patient. Hence, there is a great relationship between the quality management principle and the patient care. So this has affected several principles in the health institution. In most instances, the patient given the right to choose the doctors or the nurses which they need. So in addition, prior to expansion in the health care institution, the impact on healthcare quality has to be determined to ensure that the expansion is not compromising the quality of service offered, such as the cost of healthcare will be too high, hence not affordable to the patient. So this has contributed to the rise in the benchmarking policies, where hospitals are meant to borrow ideas from other hospitals on how to improve on health management. So to ensure that the idea discovered that could be potentially save life are used globally, only credit is given to the doctor's behavior. That idea is to encourage innovation. So quality management is a continuous process that aims to improve the quality of healthcare by improving the entire healthcare system. So researchers continue to be undertaking so innovation idea can be obtained. However, there are many barriers that have faced health practitioners whenever they want to apply research knowledge into practice. So the researchers group often differ in terms of age or experiences. So it may occur that a patient is way older or has other diseases alongside that makes it difficult to fully apply medical research. So thereby, it calls for a single subject design to be undertaken where the patient is solely studied and a unique solution can be applied by Curtis 2016. This is common for social workers or psychiatrists who deal with many different cases. So more researchers' design should be adopted to mitigate the problem of translating research knowledge into innovation practice. This is all I'm going to say. The below is my references. You can see my references below. And I hope you guys enjoy my presentation and be safe out there. And thank you for listening. Have a nice day. Bye.